We will see in this video about the femoral artery in detail and the anastomosis it participates with its neighboring arteries. So in a gross overview, the abdominal aorta will be dividing into common iliac arteries, and each common iliac artery is further divided into the external iliac artery and the internal iliac artery. The external iliac artery, which enters into the front of thigh beyond the inguinal ligament, is called as femoral artery, which continues as popliteal artery in the back of the leg. In other words, the femoral artery is the continuation of external iliac artery from the inguinal ligament onwards. So before we go into the topic, one need to know the difference between the mid-inguinal point and midpoint of inguinal ligament, which is very, very important. The mid-inguinal point is the point which is halfway between the pubic symphysis and the anterior superior iliac spine. This one. This is the pubic symphysis, anterior superior iliac spine. The midpoint is the mid-inguinal point where the pulsations of the femoral artery are felt, or femoral artery is at the mid-inguinal point. Coming to the midpoint of the inguinal ligament. You all know by now that inguinal ligament extends from anterior superior iliac spine to the pubic tubercle. So midpoint of the inguinal ligament is nothing but the halfway between the pubic tubercle and the anterior superior iliac spine, which is just the midpoint of the inguinal ligament. The midpoint of the inguinal ligament has the clinical importance of having the deep inguinal ring, which is located just above this point. So midpoint of the inguinal ligament is related to the deep inguinal ring, and mid-inguinal point is related to the femoral artery. So now the femoral artery, which is the chief artery of the lower limb, this one is the femoral artery. This is the femoral artery, which is cut here. As we have removed the superficial muscles, this is how the adductor magnus and brevis are exposed to show the osteoepineuritic opening. So this is the femoral artery, which is in the front of the thigh, and that too in the femoral triangle, which is bounded laterally by the sartorius, medially by adductor longus, above by the inguinal ligament. And this is the femoral vein, and this is the femoral nerve with its branches. A big branch from the femoral artery, what you are seeing here, is the profunda femoris artery. Now this chief artery of the lower limb, which is the femoral artery, is the continuation of the external iliac artery as it enters into the front of the thigh in the femoral triangle behind the inguinal ligament, corresponding to the mid-inguinal point within the femoral sheath. So this artery, it runs downwards and medially in the femoral triangle, and then it continues in the adductor canal, and at the lower end of the adductor canal, that is at the junction of upper 2/3 and lower 1/3 of the thigh, it leaves the front of the thigh through the adductor hiatus, this one, which is nothing but the fifth osteoeponeurotic opening in the adductor magnus, where this femoral artery, after passing through the adductor hiatus, it courses the back of the thigh and then continues as popliteal artery in the popliteal fossa. Okay, so this fifth osteoeponeurotic opening is nothing but an opening which is present in the adductor magnus. Likewise, there are 4 other osteoeponeurotic openings which are present, which give way for the perforators, the perforating arteries, which are the branches of the profunda femoris artery. We'll see to it later. So here you can very clearly see this is the inguinal ligament. Okay, this part is the pelvis, and this is what is the front of the thigh. So this is the external iliac artery along with the external iliac vein. This is the femoral nerve. So this external iliac artery at mid-inguinal point behind the inguinal ligament continues as femoral artery, which is present within the femoral triangle. Above it is bounded by the inguinal ligament, medially adductor longus, laterally by sartorius. And this is the 2/3, upper 2/3 and the lower 1/3 of the front of thigh, where it is passing through the adductor hiatus and courses behind the thigh, and in the popliteal fossa, which is a fossa behind the knee, as popliteal artery. Okay, so once we here it is the total, all the muscles of the thigh are present. This is the fascia lata. Once you remove the fascia lata, the muscles of the front of thigh are exposed. So here the sartorius is being cut to show the course of the femoral artery through the adductor hiatus. From here, this is the adductor canal, which is just beneath the sartorius is the adductor canal. Okay, so here even the rectus femoris is also cut to expose the branches of the profunda femoris. This is the profunda femoris artery, one of the largest branch of the femoral artery. Here you can see it is giving a branch, a bigger branch, just after it crosses the inguinal ligament entering into the thigh. It gives this branch the profunda femoris artery. This is the profunda femoris artery. The femoral artery is cut here to show clearly the other structures which are deeper to it. So this is the profunda femoris artery. These are the branches which are the perforating arteries, which we said are passing through the various osteoeponeurotic openings within the adductor magnus. And these are the branches of the profunda femoris, which we will see in detail now. Before we look into the branches and the course, we have to be very familiar with the femoral triangle. This is the adductor canal. This is the adductor hiatus, which will open to the back of the thigh, that is into the popliteal fossa. Now this femoral triangle is a triangular shaped structure, continues as a very narrow path, which is the adductor canal, both of which together it looks like a funnel shaped structure which opens into the adductor hiatus, and then it continues into an area which is called as popliteal fossa, which is a diamond shaped area just behind the knee joint. Okay, so we are concerned with the femoral triangle and the adductor canal. For the femoral artery, as the femoral artery exits from the front of the thigh via the adductor hiatus to the back of the thigh into the popliteal fossa, which is a diamond shaped structure, it is called as popliteal artery. So here the external iliac artery at the mid-inguinal point behind the inguinal ligament continues as femoral artery. As it passes through the adductor hiatus, okay, and then appears into the popliteal fossa behind, it continues as popliteal artery. This is the bigger branch, which is the profunda femoris artery, and these are its various branches. Okay, so this gross overview of the front of the thigh, which has the femoral triangle which continues into the adductor canal and that opens at the back of the thigh into the popliteal fossa. For you to know this overview is very important. Now let us see the relations of the femoral artery. So the relations of the femoral artery means its relations in the femoral triangle. Because the femoral artery is present in the femoral triangle, then continues into the adductor canal, exits out of the adductor canal to the back of the thigh, the lower part of the thigh, and then into the popliteal fossa. So the relations of the femoral artery are in the femoral triangle and in the adductor canal. So now let us see the relations, the anterior relations of the femoral artery. So this picture depicts the superficial fascia. The skin is being removed, and this is what is the superficial fascia. The yellow thing what you are seeing is all fat, and these are all the cutaneous vessels, and these are all the nerves. Once the superficial fascia is removed, then you will be seeing the deep fascia, which is called as fascia lata. If you just go little beyond, that is deep, to the fascia lata, you will see these femoral vessels which are within the femoral sheath. Okay, so anteriorly from superficial to deep we have the skin, then it is the superficial fascia, then it is the deep fascia, and the anterior wall of the femoral sheath. So these are the layers that are present anteriorly. Now what are the structures that are present anterior to the femoral artery? These greenish things are the lymph nodes, which are the horizontal and the vertical group of the inguinal group of lymph nodes, which are superficial, and then it is the superficial circumflex iliac vein which is crossing the femoral artery here, that is related anteriorly. Okay, and then the genitofemoral nerve. This is the genitofemoral nerve. This is the femoral branch, and this is the genital branch, which goes to supply the genitals. And the femoral branch, it descends down behind the inguinal ligament into the femoral triangle to supply the skin over the femoral triangle. So this is the genitofemoral nerve, which is related. And then medial femoral cutaneous nerve and saphenous nerve. These are the branches of the femoral nerve. After you remove the fascia lata and expose the muscles, you will be able to see those two nerves, which I'll show you in a while. So a bit about this femoral sheath. It is a funnel shaped extension of the fascia, which is the continuation of fascia transversalis anteriorly and fascia iliaca behind. This is fascia iliaca. So as these external iliac vessels, as they descend down into the front of the thigh, they pull these fascias on which they are resting also a bit into the femoral triangle. That's how the femoral sheath is being formed around the femoral vessels and not around the femoral nerve. So the femoral nerve is not included in the femoral sheath. So anteriorly, I repeat again, the femoral sheath is formed by extension of fascia transversalis anteriorly and fascia iliaca behind. This extends for about 3 to 4 centimeters below the inguinal ligament, and it gets blended with the tunica adventitia of the vessels. Okay, that is what is about the femoral sheath. So let us once again see what are the relations anteriorly. The anterior relations to the femoral artery are the skin, the superficial fascia, the deep fascia, which is the fascia lata, and the anterior wall of the femoral sheath. And the superficial group of the inguinal lymph nodes, the superficial circumflex iliac vein, and the genitofemoral nerve. The femoral branch of the genitofemoral nerve will be more appropriate. And then is the medial femoral cutaneous nerve and the saphenous nerve. So here the fascia lata is removed to expose the muscles of front of thigh and the structures. So this is what we have seen. This is a triangle, the femoral triangle. This is the sartorius, the adductor longus, the inguinal ligament, and the contents of the femoral triangle, which are the from lateral to the medial. It is the femoral nerve, femoral artery, femoral vein. So the other two structures what we were talking about are the medial femoral cutaneous nerve and the saphenous nerve, okay, which are the branches of anterior and posterior divisions of the femoral nerve. Okay, so the medial femoral cutaneous nerve and the saphenous nerve. In the femoral triangle, it is the medial femoral cutaneous nerve of the thigh is anterior to the femoral artery, and the saphenous nerve is anterior to the femoral artery in the adductor canal. So this is the sartorius which has been cut. So just behind the sartorius is the adductor canal, because the roof of the adductor canal is formed by sartorius. So here this is the adductor canal. So in the adductor canal, it is the saphenous nerve which is anterior, right? This is the dissected specimen. So this is the femoral vein. This is the great saphenous vein which is draining into the femoral vein. This is the femoral artery. This is the profunda femoris artery, right? This is the femoral nerve, the anterior division and the posterior divisions. Okay, and yeah, this is the saphenous nerve which is entering along with the femoral artery into as a content of the adductor canal, and you can see the femoral artery entering into the adductor hiatus, which is nothing but the fifth osteoeponeurotic opening in the adductor magnus, from where it courses in the back of the thigh and continues as popliteal artery behind. Okay, so this is what is the sartorius being cut. So you can see here the nerve fibers that are going to the sartorius. Okay, so this is the anterior division, which has two cutaneous nerves, which is the medial femoral cutaneous nerve and intermediate femoral cutaneous nerve. Okay, and this is the posterior division, which has the saphenous nerve, which is the only cutaneous nerve of the posterior division. Okay, this is the rectus femoris, this is the vastus medialis, vastus lateralis. If we cut open the rectus femoris, then you can see the vastus intermedius muscle, and this is what is adductor longus. Now let us see the posterior divisions. So this is the femoral artery, which is shown by lifting with a forceps. Medial to it is the femoral vein, and this is the femoral nerve, which is lateral. And this is what is the femoral triangle. Above is the inguinal ligament. This is sartorius laterally, adductor longus medially. So now when we see the floor of the femoral triangle here, after these things are being taken out, this is how the floor is seen. Okay, this is the iliacus muscle, this is the psoas major, this is the pectineus, and thus is the adductor longus. So this forms the floor of the femoral triangle, right? So now the femoral artery is here resting on these structures, which happen to be the relations posterior. So the relations posteriorly from above downwards are, this is the inguinal ligament, and here is the pubic symphysis. This is the mid-inguinal point. So here is the femoral artery. What are they from above downwards? It is the psoas major muscle. It is the pectineus. So between the pectineus and the longus, there is this profunda femoris artery. So there is profunda femoris artery, which is just behind the femoral artery, which is separating the femoral artery from the pectineus muscle. That means the profunda femoris artery, this one, is between the pectineus and femoral artery. And behind there is this nerve to pectineus, which is also a branch from the femoral nerve trunk. Okay, so these things are present behind the femoral artery, resting on the pectineus muscle. Okay, so let me be more clear. The structures that are between the pectineus and the femoral artery are the profunda femoris artery and the nerve to pectineus, this yellow one here. Okay, and behind these two structures is the pectineus muscle, and then next is the adductor longus at the apex of the femoral triangle. And we said that this femoral vessels, that is the femoral artery and the femoral vein, are within the femoral sheath. So the posterior wall of the femoral sheath is also related to the femoral artery, which is nothing but the extension of fascia iliaca. So this is what is the femoral sheath, in which the femoral vessels are there, but the femoral nerve is excluded. Okay, after 3 to 4 centimeters, this femoral sheath, it gets blended with the tunica adventitia of these femoral vessels. So I repeat again, the posterior relations to the femoral artery from above downwards are the psoas major muscle, the pectineus, and the adductor longus. And the structures that are posterior to the femoral artery, which are between the artery and pectineus, are the profunda femoris artery and the nerve to pectineus, and the posterior wall of the femoral sheath. These are the structures that are related posteriorly to the artery